here today to give some education to the patient in the video that we saw earlier in the course. She is a young female mother who has had a baby and is being discharged. We'd want to prepare her for discharge as far as what pain medications to take, what pain is to be expected, and when she should or should not return to the doctor's office for her pain. I would let her know, first of all, that pain is normal after labor. It's a very hard job and it's exhausting. And pain from the uterus is expected for 2 to 3 days after delivery. If she chooses to breastfeed, breastfeeding can increase her pain in her abdomen area from the uterus contracting during the breastfeeding process. The doctor mentioned that she would be going home on NSAIDs, and I know that she was not for that in the video, but I would explain to her that we understand her side effects of having stomach aches and pains with NSAIDs in the past. But I would recommend to her that it's best if you take them with food, and that usually prevents most of the side effects from the NSAIDs. It also talked about her narcotic use in the past, and didn't elaborate very much on it. But I would want to know what her chronic pain was in the past, what medications did work for her, and if she continues to ask and seek for narcotics, I would try to explain to her the reasons why she's not being prescribed narcotics at home. With having a newborn around and at home, it's very important that you stay alert and be able to care for the baby after leaving the hospital. And sometimes narcotics can make you drowsy and not feel good and, lethargic just after taking them. They also can impair judgment and things like that. So it would be best if she tried to avoid them so that she could pay attention to the baby and provide the best care to her baby. It also talked about her being homeless, so I would also maybe talk to her about how she plans on getting her medications, if she needs case management to maybe help her with the medicines or help her find somewhere that has the medications cheaper. But also the NSAIDs would be cheaper because they're sold over the counter and it's something she could get pretty easily. I would also inform her of the amount and time of medications that he's sending her home on. If he's sending her home on, say, ibuprofen, for example, I would give her the dosages of like 200 to 400 milligrams 3 times a day. And if she's still having to take pain medicine for 7 days after delivery, she should probably contact her doctor to make sure nothing's wrong post-delivery. Of course, you always want to educate your patients on the side effects of the medications you're discharging them home on. So I would let her know that the side effects of ibuprofen are heartburn, stomach upset, abdominal pain, nausea, and dizziness. And like I said earlier, that she should be taking them with food. Post-delivery pain, such as contractions or after pains, are caused by the uterus shrinking. She's going to have very sore muscles after delivery from all the pushing and straining. I would let her know that that's normal with labor. She'll also experience some vaginal soreness, including pain, discomfort, numbness. And if she had a C-section, you'd also want to talk to her about her C-section site and pain that she may experience there. And the pain at the C-section site can last a little bit longer, up to 1 to 2 weeks after delivery. She'll also experience some breast engorgement, most common on days 3 and 4. And, she can I would educate her on how to relieve that pain at home. Of course, she can take her pain medication, and ice packs sometimes work, a hot shower, warm compresses, and just anything like that. Sometimes just standing in the shower will help with that. And if she's breastfeeding and experiences pain, she can always try to feed the baby, which will relieve her breast engorgement pain. She'll also experience vaginal pain, And it can also be relieved with ice packs off and on throughout the day for the area for about 20 minutes at a time. And she should place a cloth between that and her perineum area so that it doesn't get too cold or stick to her or anything like that. You could also explain to her that if she develops hemorrhoids at home, that there is treatment for that, and that she should, she could use things like witch hazel or warm sitz baths or things of that nature to help relieve the discomfort. If she's having pain with wiping after using the bathroom, she could try to use a warm washcloth versus like toilet paper, something that's a little bit softer and easier on her sore bottom. Post-discharge, she should also be encouraged to make sure she's still holding a pillow at like a C-section site when she coughs so that she doesn't bust any incisions open. You'd also, of course, want to educate her on C-section care and all the things that go along with that so that she doesn't experience pain when she goes home, if she can try to prevent it, like no lifting anything heavy and like carrying the baby carrier if she has someone there that can help her with that. After all this explanation, we would hope that she would have a full understanding of her pain and why she's not getting her narcotics. I would also just tell her that if pain continues and she feels like something's not right, she can always call the office and ask for a follow-up appointment to investigate what's going on and why she's still continuing to have pain.